Hi, another blog post about abdominal pain, tummy pain. Very, very common. Um, Most often benign and just needs a bit of time to settle down. So, you have to obviously be cautious about things like appendicitis, which needs urgent surgical intervention. Or there's a condition called torsion of the testes, obviously in boys, especially if the testicles are very tender on one side, then you should immediately take your child to A&E because that needs surgical intervention to save the testes. You've got about 6 hours from the beginning of the pain before it needs to be treated. And appendicitis obviously sometimes can be grumbling, takes time to develop, but if it's inflamed and really causing trouble, then it needs to come out. But other tummy pains are benign, as I said. Most of the time, they are related to a viral infection, may have vomiting associated with, or sometimes diarrhea. You have to make sure it's not a urine infection. In children, they do not have symptoms like dysuria or frequency of micturition because they'll not be able to tell you if it's hurting when they're weeing. They might just cry. So a urine dip has to be checked if they are complaining of recurrent abdominal pain, especially associated with fever and vomiting. That's the most common symptoms of a urine infection in a child. Constipation has to be ruled out because sometimes if you're bunged up, then obviously it'll hurt. And then there are some other conditions which can cause long-standing abdominal pain. One of them is called mesenteric lymphadenitis, which means inflammation of the glands in your tummy. Um, as opposed to appendicitis, which is on the right side, this can be on the left side or both sides or just on the right side. So that's a viral inflammation of the lymph nodes. Sometimes there might be a bacterial superinfection, but most of the time it's self-limiting and gets better with time. You might need some painkillers and anti-inflammatories for the glands to settle down. There's one very common condition called functional abdominal pain, which is pain lasting for a long, long time, not getting better. All the investigations, including ultrasound of the abdomen and blood tests, are normal, but the pain just does not go away. Very common in children, I would say between 5 to 10 years of age, sometimes older. And there's nothing wrong with the child. It's a very complicated condition. I'll put a link in the text here, which you can click on. There's a big resource pack. So it's a condition which has got a little bit of psychological element to it. It starts with viral infections, so viral gastroenteritis, and then the pain just persists after that, especially after eating. Medications may have been tried, but they don't help. It's just reassurance that helps because the perception of the pain changes. And although it might be a bit of discomfort, the child may perceive it as severe pain. And the only treatment that's prone to work is to reassure the parents, make sure they understand that there's nothing wrong with the child, and then slowly it gets better with time. But have a look at this resource, read it, and if you've got any questions, please put it in the comment. Sorry, a bit of a longish post, but I hope it was useful.